I just came back from Korea Derma 2025, and it was a fantastic meeting. Here are the biggest things that I learned at Korea's largest dermatology conference. My name is Dr. Roy Kim. I'm a plastic surgeon, and I was honored to speak at Korea Derma 2025, which was held in late October, early November 2025. And here are the things that I learned about. In terms of neurotoxins, not much new in terms of technology. Hugo/Benev, that relationship is continuing, and the ability to have Latiba in the US is called Botulinum in Korea will be increasing. As you may know, I've been battling about Latiba for a long time because it is an FDA-approved product that is a direct Botox/Xeomin/Jeuveau/Dysport/Daxxify competitor. I love Latiba. I do think it's a cost-effective option for many patients, and they're just increasing the amount of sales, marketing support, and so on in terms of growing that specific brand. I think the second biggest topic is the continued use of combination therapies. Now, this is something that is still not a thing in the US, and I think it's directly related to cost. If you think about it, we can actually improve skin at the very superficial level, in other words, with skincare, with stuff that you can do, the skin that you could see. Directly underneath the skin, not very deep, but there are things that we don't really use a lot in the US. It's called Skin Booster in Korea. That really helps. And finally, at the deeper layer, we have some of these things, specifically fillers for contouring and so on, but Korea actually has more dual, triple, combination hybrid fillers, which I'll be discussing. If you think about this combination treatment strategy, it totally makes sense. You want to have holistic care of your skin. Having said that, the cost of medical devices, of injectables in the US is pretty high. Because Korea is a lot more competitive, they have a lot more products, and I also think because Korea has a slightly lower per capita income per household, the costs are definitely reasonable for an average Korean person, and by American standards, they're really low. To do this in the US would probably cost in the order of $2 to $3K a month, just in terms of skincare, injectables, and medical device care. So I think that's pretty much out of the reach of most Americans. However, with increased competition, I do think that this cost will go down over time. I think the biggest change and where Korea is extremely advanced is in fillers. I'm going to be going through all of the things that I noticed. Some of it may be a little too nerdy. You can always speed through it. But they have fillers that are much more advanced than what we have in the US and pretty much the entire West. I do think that we in America are on 5th generation fillers, and Korea is more like on 6th generation fillers, possibly even further. They do have a more lenient way of looking at fillers, and this is not totally knocking the FDA. I think that there do need to be possibly more studies in terms of efficacy, how effective these things are. And interestingly, some of the restrictions that we have in the US actually exist in Korea, but some Korean companies have used their products more in the cosmetic world as opposed to the treatment world. So first up, the concept of hybrid fillers. We actually have this in the US. This is a less popular filler known as Belafil, but it's been around for a long time. There's nothing wrong with it, FDA approved. It has two major components, collagen and PMMA. When I inject Belafil, you get an immediate result, but it's not from the main ingredient, the PMMA microspheres. It's actually from the collagen. So collagen doesn't last that long, but that's what fills in a wrinkle or gives you an immediate result. That typically only lasts a couple of months, and it allows the PMMA microspheres to actually induce collagen to grow in. If you look at Belafil, it is a 5-year filler. Pretty remarkable. It's about 60 months. That's not from the collagen. That's from the PMMA microspheres, polymethyl macrolate, and they form little balls or microspheres. To my knowledge, this is really the only FDA-approved hybrid filler that we have. Well, Korea is going faster than the US. They have ways to combine HA, which is a filler that we know and love, with CAHA, calcium hydroxyapatite, and or PLLA, similar to Sculptra, and or PDLLA, a slightly different chemical cousin, if you will, to Sculptra, and other substances. They have a lot of different brand names, a lot of different companies, and I'll break it down for you sort of in a simplistic way. We already have HA fillers. They're known as Juvederm, Restylane, Belotero, Prolenium, other brand names in the United States. Interestingly, these companies make multiple different kinds of filler. We want a very robust, very strong support around the jawline or maybe at the zygoma. We want a lot less support in the under eye or the lips because you don't want something that maybe you can't see but you can feel underneath that skin surface where you have very delicate or thin skin. Of course, in Korea, they feel the same way. However, they now have combined products where they have high molecular weight HA filler, which is more robust, and low molecular weight filler, which is less robust. It's more meant for areas of very thin skin. They put it into one syringe. So as a patient, you have the effect of support and yet still have the effect of having better looking skin because the HA helps to moisturize the area, help it glow. Now, of course, we could replicate this in the US, but you would need 2 shots. You would need one syringe filled with the high molecular weight and one syringe with the low molecular weight. Then there's another problem. The high molecular weight stuff typically is given deeper. It's more filling, whereas the low molecular weight stuff is given sort of at the skin surface, like a skin booster. I think the best equivalent would probably be Juvederm Voluma with Juvederm Skin Vive. Voluma is really meant for robust support, whereas the Juvederm Skin Vive, to be honest, it really is not going to give you any support, but it is a wonderful skin booster. Korea has a product or two in that category where it's all combined in one syringe. Next up, they have something that I actually got a couple months ago. They have PDLLA plus HA. So what's PDLLA? It's a chemical cousin very similar to Sculptra, which is PLLA. PDLLA is not as robust. It has smaller microspheres that are actually more consistent. Why is this important? Because if you give it as a skin booster, in other words, just underneath your skin actually has fewer fine wrinkles. It glows better, and it has better moisturizing effect on your skin. That should last around 6 months, maybe a little longer. So Juvalook is a brand name no one's ever heard of in the US, but that's a combination agent plus an HA. That is what I got, and then people have commented that my skin looks better. I do feel that my skin is actually more moisturized without doing anything special. They do have other hybrid fillers, calcium hydroxyapatite, the main ingredient in Radiesse. However, this is not the Radiesse version at all. This is not the manufacturer of Radiesse. Rather, it's a completely separate company that uses the generic calcium hydroxyapatite and mixes it with HA or other substances. Calcium hydroxyapatite combined with HA does deliver overall better skin care. It's used as a skin booster, and it really helps your skin glow for a longer period of time, let's say several months. In Korea, they've started using micronized ADM. So this is acellular dermal matrix. To backtrack a little, acellular dermal matrix is what we have in America. It's typically harvested from cadavers, and you create a dermal sheet, and we use it in breast reconstruction a lot of times, along with hernia repair, things like that. The nice thing is that it gives support, it gives structure, and it typically has a lot less scar tissue healing, which is why plastic surgeons love it. In Korea, they've micronized it. So they've chopped it into very fine bits and used that as a filler. It is actually used in Korea in certain breast reconstruction cases because you can actually liquefy it and then squirt it into an area that's having a harder time to heal, as opposed to opening it up, doing surgery, and putting in a whole sheet. That has a huge advantage. But for aesthetic use, micronized acellular dermal matrix is human tissue. So what they say is sort of going from skin to skin. Your body recognizes that it's human tissue, not a separate chemical. And it really has a wonderful effect in terms of the way it looks for filling. It has a great effect in terms of the way that your skin appears if you use it as a skin booster. I don't know the answer to this yet, but we actually have something like it in the United States. We technically do not have micronized acellular dermal matrix. However, we have something known as Renuva, which is fat harvested from cadavers, and we have Dermaclay/Alaclay, which is a completely separate company, and they also harvest fat from cadavers, put it into syringes, and sell it to plastic surgeons for various uses. Dermaclay technically is for the face. It's not really out yet, but they do have Alaclay, which is meant for the breast, body, and other reconstructive areas, as well as cosmetic use, and that comes in larger syringes. So right now, obviously, if you have your own fat, we can actually harvest your own fat and then place it into your body. We can do it for reconstructive or cosmetic use. The advantage of the stuff that we can purchase from a manufacturer, Renuva, Dermaclay, Alaclay, is that we only have to crack open a box. We only have to open up a sterile container with the syringe inside of it, and then we can start using it immediately. This is great in very thin patients who don't have much fat to actually harvest. This is also useful in case you just don't want to have a liposuction procedure and you want to actually have immediate fat grafting for cosmetic or reconstructive purposes. As you probably know, fat should last forever or should last for a very long time. Now remember, it doesn't stop aging, but in terms of fill, once fat gets reintegrated into your body, it should last for a very, very long time. Another thing I noticed in Korea is that there's an increasing trend towards medical grade skincare. This is not necessarily prescription only. However, more and more dermatologists, dermatology clinics are releasing their own version of skincare. And trust me, it's pretty awesome. So I'm very, very impressed with a lot of what they're doing and a lot of the technology behind it. One of the things that is new in terms of technology for skincare are spicules. They're also known as Reedles, R-E-E-D-L-E-S. That is sort of a trademark name put out by a company. Spicules are little tiny, if you will, needle-like things that are in your skincare that actually feel slightly rough in terms of lotion, or sometimes they actually put it on actual tiny masks. So they're not that sharp, they don't induce bleeding. However, what they do is they cause a slight indentation of the skin. Occasionally they can break or irritate the skin, which is the whole point, because then it can deliver some sort of chemical or substance that you want to help with overall skin care. We all know that just putting something on topically, we have to wait for the skin to absorb it or go through very tiny pores. If we can actually break the skin surface slightly, the thinking is that we can deliver a little more of the wonderful chemicals that we have to reduce overall wrinkles, to help with skin glow, and so on. This is an example utilizing spicules. This is Therapetic, the Riedel patch. I don't know if you see it there. What this does is, if you look at this entire protocol, you're supposed to actually cleanse your skin, get it prepared, it's all there on the back, and then there are two masks here. You can open it up and apply it to your face exactly where you want the spicules, specifically where it's delivering a certain chemical here. This one is retinol, bakuchiol, and volufiline, a couple brand names. This is a vegan formula, and your skin's prepped. There's slight skin irritation, and it delivers this product directly to where you want. It's pretty cool, and I do think that we don't have anything like it in the US at all. I guess you could replicate it by scouring your face with some sort of, I don't know, steel wool. I'm joking, don't do that, that's bad for you. But if you irritate your skin and then deliver some chemical, you should have a higher concentration, better penetration, more of that product delivered to your skin. So DoubleTite, this is very interesting technology. It's a medical device made by Agnes Medical that's not technically FDA approved in the US. I don't know if it will be. DoubleTite is a dual combination medical product. It has RF microneedling and it has a tiny injection gun that can actually inject skin booster simultaneously. The cool thing is that they have the timing right. So typically, if you think about it, if you inject skin booster, this is a chemical just underneath the skin surface, then apply RF microneedling, the energy may actually melt or change the chemical nature of the skin booster. Agnes Medical has figured it out so that when you inject the skin booster, it is injected at a depth and a different depth than the RF microneedling device. The higher temperature of the RF microneedling needles does not alter the chemical of what was just injected. So it's a very cool combination. Instead of me doing it separately, it can do it simultaneously in one machine. The FDA so far has not approved it because they are very concerned about the dual combination approach. Whereas it's very safe and it's really been approved in Korea and in Europe and other continents. We will see if it actually gets approved in the United States. So I'm rooting for them. The PN injectables, polynucleotide, and of course the most famous one in the US is Regeron. Those seem to be extremely safe. So any time that you inject a filler, yes, it's very rare, but it can cause what's known as vascular occlusion. If you accidentally inject it into a tiny blood vessel and it actually starts blocking it, we can have reactions with how well the tissue is bleeding, how well there's blood circulation in that area, and so on. So that's a big no-no. It's no one's fault. So specifically, it's not the patient's fault or the injector's fault or even the nature of the filler, but this is a rare complication that is known within the filler and injectable community. Interestingly, with PN, even though it is technically a filler or skin booster or both, there have been very few, pretty much no complications related to significant vascular occlusion. So that is a very good thing. We will see and keep an eye out for this, but the good news is that despite the fact it's based on salmon DNA, and despite the fact it is a different type of injectable, the profile seems to be extremely safe so far. And it has been given a cajillion times in Korea and throughout the world. I've included a little tiny presentation slide here, which shows how PN is really viewed by the Korea dermatology community. I've included a little slide here as to why I think that we are on 5th generation fillers, but Korea may be on to the 6th generation or further types of fillers. Here's a cool slide on extracellular matrix. In other words, getting cadaveric human tissue to be used as a filler. This seems to actually offer the most benefit, and this is the direction that Korea Dermatology is going towards. So while I was at Korea Derma, I got to meet one of my influencer friends who I've actually never met in reality, Dr. Ji Ju. She's right here. Definitely follow her on Instagram and TikTok. She's huge on both platforms. It was great to reconnect with Dr. Caroline Kim, head of the Korean German Aesthetic Face meeting, and we're having another meeting in February 2027. So definitely keep your eyes open for the exact dates and times and registration details. It's about a year and a half away, but we hope to see you in Vienna, Austria. I want to thank Drs. Ri and Dr. Shin. They're my friends, they're amazing dermatologists, and they were kind enough to invite me to talk about Korea versus Western aesthetic values, how to achieve them using Korean technology, and also how to monetize it. Specifically, there are a lot more Western patients coming to Korean dermatology clinics, so there is a slight disconnect as to what Western patients want. I don't think it's a huge disconnect because I think Korean dermatologists do a great job. A lot of them understand English, but because of some cultural differences and some expectations, I talked about how we can smooth things over to better deliver beautiful aesthetic results to Western patients. And interestingly, there are some opportunities for the Korean dermatologists to actually monetize this. So in other words, it's not just giving a procedure. It's more about developing a long-term relationship. I definitely see a niche of patients from America, from the West, going to Korea every 6 to 12 months forever until the West and specifically America can catch up in terms of offering the best and latest in Korean technology for skincare. As always, it's fun to go back to Korea, even though it was a very quick business trip. I learned a lot, enjoyed the food. It's wonderful walking around. It's just fantastic to see old friends and to make new friends. So I'll be having maybe a couple more nerdy discussions on this hybrid filler concept. If you have any questions about Korean skincare or anything I covered, please let me know, fire away. If you want me to talk more about something, I'd be happy to make a video. This is a 3-day conference, so it was sort of hard to just encapsulate all the biggest things I learned in just such a short video, but I tried. So thanks so much for watching.